Welcome to the Rethinking surveys, where we will dive into how hospitals are transforming community health data into a strategic asset to fuel smarter decisions across departments, from strategy to population health, equity, outreach, and innovation. I'm your host, Angie Grover, Chief Operating Officer and co-founder of Metopio, and we are proud to partner with the American Hospital Association to feature hospital leaders who are using technology and fresh thinking to elevate how community insights drive impact, collaboration, measurable change, and enterprise alignment. Let's get started by introducing today's featured healthcare leaders. Kristen Soni is the Director of Community Health Needs Assessments for Atrium Health, which is part of Advocate Health, the third largest health system operating in 6 states. Kristen has more than 20 years of healthcare experience in prevention, wellness, operations, and community engagement. She also maintains her national counseling license and brings a patient-centered focus to her work. Will Snyder is the Chief Executive Officer and co-founder at Metopio. Will brings unique mix of technology expertise and community health experience to the table. He helped develop one of the largest community health collaborations in the city of Chicago and earned national recognition for his community development work in Richmond, Virginia. Will's been involved in more CHNAs than he can count, and I can attest that he is passionate about using data and innovation to make the entire CHNA and CHIP process more effective, more collaborative, and more actionable. So let's get started today, Will, with you and Kristen. Thank you so much for being here and talk a little bit about the whole question of to survey or not to survey.
Yeah, and thanks, Angie, for having me. And hello, Kristen. Excited to dig in this because I think data collection is one of the most important parts of a community health needs assessment, being able to supplement what's already out there, but also really thinking with your partners about what questions need to be asked, what is missing. And so I'm a little biased. I think absolutely anytime you can run a survey, you absolutely should run a survey. And the beauty of technology and platforms like Metopio and then Metopio's partnerships with some surveying instruments is that it's really easy to do now. And we'll get into some of the processes and the efficiencies there, but I lean very much towards always surveying when possible. And I think one of the reasons why we want to think about surveys is we have a lot of different disparate data. So you have, as you can see on the slide, ways to supplement secondary data or potentially utilization data from a hospital or a clinic, or program data from programs that you or your partners have been running. And it really, surveys help you understand the perception in the community about disease burden or drivers of health. It helps you understand the prevalence more accurately and also the burden. So when we think about burden, we want to understand not only who's impacted by something like diabetes, but what other confounding factors might be in the community that prevent them from being able to manage that diabetes or live a healthy lifestyle. So we think about things like food deserts or access to food, transportation to be able to get to appointments, access to pharmacies, access to nutrition classes or fitness centers, those kinds of things. And a lot of that is hard to get without really going directly to the community and asking those questions.
Angie, I love this question because this is something that our collaborative and Advocate Health also really thought a lot about. And I think I want to back up really to the beginning of this and think about, just the question in general, do you survey or do you not? And I think there's a lot of thought out there that you can skip over the survey. And I'll be honest, we all had really deep discussion about, do we actually do a survey? What are we going to get from it? And ultimately landed on a couple things. One is that it is going to validate your secondary data. How do you really make sure that you hear the voice of the community? And I think that's really one of the big pieces. So for us, it was, how do you survey in a way that people are going to finish the survey? You're going to get maybe a little bit of information that you're not getting from secondary data. So you can really figure out where you want to dig in. And there were two other big things that we really focused on. One is, how do we not duplicate things that are already happening? So that was a real big part of our collaborative, is how do we work with folks that are already doing surveys? How do we pull that data in ways that maybe that we haven't before? And the other big piece of it for us was engaging the community. How do you make them feel part of this? But the big piece for us was don't ask the same questions over and over. Make sure that your survey is unique and make sure that it gives you really something different that you're looking for to understand your community.
Yeah, and I think that we're going to touch a little bit about how valuable creating that local data is. So, with that, it really sounds like you both agree that conducting a community survey is a valuable part of the process. And once we make the decision to do a survey, really the next question we find is what kind of survey? So, for those of you who might be new to this work, there's a lot of different ways to conduct a survey. And well, I know you've done all of these. So, can you dive in a little bit and talk about the pros and cons of these different types of surveys as people think about that and using it in their process?
Yeah, absolutely. And a survey could be as simple as like, what do you want to have for dessert? Asking your office mates or your children or your family to, really trying to understand community perception about some macroeconomic issue. And I think we're all familiar, especially coming out of the last election cycle, of surveys, and also the importance of understanding how to interpret the data out of surveys. So at a foundational level, before you even program it, before you even really think about how you want your questions to go, your sequencing, all of that, you really want to understand how you're going to be sampling the public, the people that you want to take your survey. And so you see 5 options here on the slides. These are sort of the most common ways to think about your sampling. And really what we see often are kind of 1, 4, and 5, or in some cases, a mix of all of 1, 4, and 5 with community-based surveys for community health needs assessment. So the first one, really think about quota sampling. So this is where you are intentional in your design of your survey panel by focusing on subpopulations. So if you think about the survey construct, really, like you want to understand what your margin of error is going to be, your confidence interval, and so forth. There are a lot of tools online. Certainly, we help as well. I'm thinking about, okay, here's my population. How many surveys do I need to get in order to get to a 5% margin of error, a 3% margin of error, and I want a 95% confidence interval or a 99% confidence interval. And we can provide some technical documentation that explains that outside of this webinar. But generally you're looking for a 5% margin of error, plus or minus 5%, you'll see a lot of times, and 95 up to 99% confidence interval. So with that, if I'm surveying a population of 500,000 people, if I just want a general sample, so the convenience sample, that's going to be about, anywhere from 400 or so to 1,000 responses, depending on that margin of error. But if I want to look at that and say I have 500,000 people, 100,000 are over 80 years old, and 150,000 are Hispanic or Latino, and 75,000 are non-Hispanic Black, you might then use quota sampling. So you're then going to start to think about, from each one of those groups, those subpopulations I'm interested in, what's the sample size I need in order to achieve a statistically significant sample size. So as you can see, one of the drawbacks of quota sampling is you do introduce bias because you're deciding in some ways like what the subpopulations are. It's not necessarily reflective of the full community. And on top of that, you're often looking at like a single dimension of a person. And we know that, just education level or just income level or just race and ethnicity or just age is not going to tell a full story. So you want to be careful with quota sampling to make sure that you are trying to get as complete a picture as possible. Representative sampling is, again, similar to quota sampling, but you're really kind of trying to set a panel that looks more multidimensional across a community and helps you try to better represent the demographics of the full population. Statistically valid sampling gets a little more complex. So this is where you see the price point go up a lot of times when you're running surveys that you're thinking about random dial or, like paper mail, sending stuff to houses with QR codes or incentives, all that kind of stuff. So just a little bit more complexity to it, but of course the accuracy increases with that sampling. And then random sampling and convenience sampling often kind of go hand in hand with community health needs assessments. And while they're 4 and 5 here on the screen, this is not a ranked order by any means. This is, again, just trying to show you the different types and to help you understand that as you do a survey, you want to be very clear with how you sampled up front, because that's going to be very critical on the back end as you start to analyze that data, process it, and then more importantly, when you share it with stakeholders in the public to be able to defend the insights that are generated from those surveys. So random sampling, just like it sounds, you walk into a grocery store, congratulations, Angie Grover, you're the 10th person to walk through the door, please take this survey. Just a random distribution. And then convenience sampling is often the most cost-efficient way to do a survey that requires more weighting and analysis on the back end than the other methods. And this is, we have a partner who runs a food pantry, so we're going to distribute the survey through the food pantry. We've got another minister at a church who wants to give the survey to his congregation. Then we've got a school where we're going to distribute it to the teachers. So you think about sort of that place-based distribution, and then on the analysis side, you have to consider all the variables and where it was distributed, who took the survey, and so forth. And that's where we get into the process of weighting. But this, I think, really outlines how you want to approach this. How accurate do you need this to be? How much work do you want to do on the analysis side? And then ultimately, what is your budget? Because all three of those variables will dictate how you design your survey and what you think about with sampling.
True, very true. And also important because no matter what type of sample you use, you're really bringing in that lived experience. And Kristen, I do want to set you up to talk to us a little bit about what you're doing in North Carolina and your leadership role and bringing together healthcare, public health, academia, nonprofits, and everybody to the table to talk about a survey and work together through this process. So before we jump into this, I would love for you to tell us a little bit about what you're doing in Central Carolina and tee us up for the survey discussion that you guys had.
Sure. Thanks, Angie. Yeah, so this work really started post-COVID, and Atrium Health and other health systems were at a community meeting. And I ended up having lunch with our Novant team, and we really started talking about post-COVID, what things should look like, how do we collaborate, how do we do things differently? And the conversation really went to community health needs assessments. How do we partner in this space? How do we not duplicate efforts? And we joked about it and said, if we can work on a global pandemic and solve that together, I think we can certainly work on community health needs assessments together. So that's really where this work started. And I will tell you what's been exciting is that what we plan to do, we've done far beyond what we planned. And so this group is much larger than we expected. And so, in current state today, we have 6 health systems. That includes almost 30 hospitals. We have 10 health departments at the table. We've got 4 United Way agencies. We're working with some academia partners. We're working with some consultants. So we're really looking at this from a really broad perspective. And I will say that the survey has certainly been a big part of the conversation. And when you look at all these organizations together, I think the real goal here is how do we not duplicate efforts? How do we get better data together? Because what we kept hearing from the community was, quit asking us the same questions. Just go out and do the great work that you can do. And so that's really what I think has started to push our collaborative into being really innovative. And getting data that is very meaningful for all of us. And I think what's really important to think through here is while you see 6 health systems and nearly 30 hospitals, in this space, there's not competition. In this space, this is where we lock arms, and this is where we, march forward together and really figure this out together. So it's a really exciting time for us to, put away the ego, put away the competition, and really put the community at the forefront and doing great work.
And you guys have done that in spades for sure. And I think one of the most unique elements really of the collaboration is that you came together around a shared survey process. So like what Will was describing, what kind of survey do you want to do? Who wants to be engaged? And what is the ability for each of the partners to leverage the investment to create their own community health needs assessment? So beyond kind of the obvious benefit of maximizing limited resources, can you share some of the considerations and discussions that you had to bring everybody to this point and what was so valuable about that?
Yeah, I mean, really, first of all, I think what we have to say is for most of the organizations, they got a better response through this shared survey. So I think that's a really exciting thing to look at. In some cases, we had some of the agencies or organizations that hadn't done a survey before. So this was a brand new opportunity for them. So in this shared space, we were just able to get such better, just a better product at the end. I think the other piece was when you're looking at a full region. And so when we're talking about our collaborative, we are in the center part of North Carolina. And so when you're really trying to compare benchmarks and you're comparing different parts of the state, we had a really hard time doing that because people were asking different questions. They had different data sets, they had different timing. And so really that's part of what we've been able to bring together is we took the best of everybody's surveys, put them together, crosswalked all of it, figured out what was in the secondary data, and really pared down the survey so we get great data out of it. So now at the end, we can actually look from county to county, from agency to agency, look at the same data, compare it, understand it, and ultimately it's going to change how we work together and serve our communities.
Yeah, we're going to take a look at what that looks like too, because really what we've done by everyone using the same survey and using Metopio, you have this shared data. The topics from the survey are on Metopio. Everybody can, all the engaged partners can go pull them down, look at them for their community, and there's now this collective resource that's parlayed into what you are sharing with your community. So, we often say technology doesn't replace strategy, it makes it visible and sustainable. And I think that's really what's happened through working with all of the different partners in the collaborative with you, Kristen.
Absolutely. We're finally able to look at the same data at the same time and use it in a really important way.
Yeah, so it is a huge leap forward. And so whether, you're doing a survey for your organization or in a collaboration with others, Kristen and Will, if people want to follow in your footsteps and follow your lead from this conversation, what are some of the things that you think they should consider as they move forward?
Yeah, I'm happy to start, Kristen, and then hand it over to you. It's a great question, Angie. I think, you know, in this era of data uncertainty, being able to create and possess primary data as an organization or as a collaborative is incredibly important. It gives you a foundation for which you can more accurately design your focus groups, key informant interviews. It becomes data that can feed into other parts of your provider organization, or it can be a resource for how you allocate funding and grant resources in the community. So I think at a high level, there's just this incredible value of creating data in collaboration with your community and with your partners. But you also have to do it correctly. So just the first point to me is so important. You really want to be strategic in your methodology. You want to be able to defend it. And there's a reason why not everybody's a pollster and not everybody can interpret surveys. They have some statistical elements to it that do take some data science. And we're conscious of that and constantly trying to think about ways to make it easier to do, easier to interpret, and so forth. But I think if you start with the foundation of understanding your methodology and then designing around that methodology and distribution process, you'll be incredibly successful. I think, I've been involved with surveys for longer than I want to admit year-wise as I think about it. But if we think about it years ago, it was like you might be able to get like an online survey, but a lot of surveys were paper surveys. And now we think about it, we have a collaborative client who's doing a rather large survey across a Western state. And, out of about 2,000 responses, only 100 are paper responses. So the technology is really there and makes it so much easier now to be able to program, test the survey. They even have AI built into a lot of survey tools now where it will tell you like, this is going to be difficult for people above or below a certain reading level. This is going to take more than 10 minutes to complete. You're going to have drop off, all that kind of stuff. So it's so easy to understand the burden that your survey is going to put on whoever is taking it with all this technology. And then the exciting thing is to think about both the program management of the survey into analysis and then into distribution and making that seamless. So, at Metopio, we have the ability to ingest the survey tracker so you can see who's responding to surveys in real time, where they're coming from. You can adjust your distribution strategies. You then have the ability to analyze and then create and share survey insights. So it's just really exciting. The technology piece here, I think, reduces the not only the cost burden, but sort of the statistics knowledge burden as well. And the more we can put subject matter experts out in the field asking questions, gathering that information, the more progress we're going to make on really challenging issues by finding those folks who are suffering from them or experiencing those hardships and be able to bring that data back in-house. But Kristen, I'd love to know from your perspective, kind of additional takeaways or learnings that you've had in the survey process.
Yeah, I'm going to go out of order a little bit in these check marks. And I think I'm going to go with the third one where it says collaborate. And I think that's been the biggest piece for us, is how do we look at all of these partners as shared experts? And I think that that's really what's been a fun part of this process, is to pull community partners, to pull all this expertise together, recognizing that we don't have all the answers together. So I think that's been a big piece of it. Pulling in community partners, other community experts, not duplicating the data, finding other sources, other folks that are out there doing some of the work, pulling those in, and really, how do we share that work? But then on that second check mark where it says use platforms like Metopio, I wouldn't just say platforms. I would say use partners like Metopio. And so that's been the beauty of this, is not only have you guys created an amazing platform for us, but you've been partners in this work. So we recognize, again, we don't have all the answers, and you've been an amazing partner to figure out, what can we do better? How do we do it better? Will, I think there's a whole nother conversation to have around AI, and we've been able to demo some of the AI tools in one of our key informant interviews, and that's been fascinating. But I think that the platform with Metopio and the partnership has just been invaluable to us, is how do we take our work to a totally different level. And the sophistication that we're able to add has just changed the game for us. And then, how do we use that survey into a valuable, reusable data asset? I mean, that's the thing that what we're doing is we're building a survey for this first cycle, and how do we consistently build on that for future cycles and use that data as we work with the community better. So absolutely do a survey. If you're thinking about whether it's yes or no, absolutely do it. And all of the things that we've talked about with collaboration and the platform are an absolute must to make this go to the next level.
Yeah, and this is just the beginning of a long-term, hopefully, partnership that really improves health outcomes in North Carolina. So while most hospitals have data on who walks through their doors, they lack the context for what brought those patients through the doors, or they're missing ones that don't show up at all. So today, Kristen and Will have really shown us how important that community context is to inform how you move forward, how you improve community health, and improve the health outcomes in the communities that you serve. So thanks for joining us today. If today's conversation has sparked new ideas or given you a fresh perspective on community health data, we'd love for you to share it with your colleagues or access the recording and assets we have made available for the American Hospital Association members by scanning the QR code here. I'm so thankful for Kristen and all her work in North Carolina, and for Will and his leadership. Until next time, I'm Angie Grover with Metopio. Thanks for listening.